Good morning and good afternoon. Welcome to today's webinar, OHSU's Prior Auth Automation Success Story. My name is Phil Dolan. I'm Chief Growth Officer at Valer. We're a provider of automation technology that speeds and simplifies prior authorization management by automating submissions, status updates, and verification. Before we get underway, I'll share a few housekeeping notes. First, today's webinar is planned to run 45 minutes, so you'll have some time before the top of the hour. Our webinar is designed to help educate you on an approach to improving your prior authorization management. There is no product demo today. However, if you have interest in Valer's solution, you can request follow-up in the survey that you'll receive at the end. Even if you're not looking for help with prior authorization management, we'd love your feedback on today's webinar. Survey respondents to a simple 5-question survey will be entered in a drawing for a $100 Amazon gift card, which we'll email the winner following today's webinar. We'll also let you know, again, who's won that drawing. So remember, you've got to be in it to win it. We invite your questions throughout today's webinar, and we'll address as many as we can at the end. You'll find a Q&A button at the bottom of your screen, and I'll read your questions to our panelists at the end. You may also use the chat button if you want to share any thoughts with other attendees or our panelists. Finally, we'll be recording today's webinar. We'll make today's recording and the slides available, and we'll send both to you by the end of this week. I'd now like to introduce you to today's speakers. First is Dr. Steve Kim, who's co-founder and the CEO at Valer, again, a provider of solutions that automate prior authorizations. With more than 20 years of medical experience and a passion for studying value-based care outcomes, Steve's expertise has been vital in navigating the evolving complexities of the healthcare industry and identifying the administrative roadblocks and bottlenecks delaying access to care. Before his transition into entrepreneurship, Steve was an assistant professor of urology at the University of Southern California's Keck School of Medicine. While at Keck, Steve also served as director of clinical research informatics for Children's Hospital Los Angeles, in addition to practicing pediatric urology. Steve earned his undergraduate degree at Yale University and was awarded his medical degree from Cornell Medical College. Our second panelist, Joe Whipple, is the manager for centralized managed care and price estimates at OHSU, overseeing authorization submissions, insurance verification, and price estimate functions. Joe has worked in healthcare operations for the past 8.5 years and is currently the manager of centralized managed care and price estimates at OHSU. Joe's areas of time and focus include leading 83 managed care coordinators, covering over 20 hospital specialties across 2 facilities, creating continuous process improvements and aligning processes across the organization. Joe has been instrumental in co-designing additional solution functionality in the area of automated authorization and certification information flows into Epic during the pandemic, as well as coordinating staffing. Joe is CRCR certified with the HFMA. Steve, I'll let you take it from here.
Wonderful. Thank you, Phil. And I want to thank everybody for taking time out of their busy schedules to join us, and want to give an extra special thanks to Joe for being gracious with his time and also sharing some of his experiences and the journey that we've been on in this partnership with the Oregon Health and Sciences team over the past several years. I think for those of you who may not know who I am and kind of a little bit of background on our company, I do want to share a little bit of context. Certainly the star of the show will be Joe in terms of talking about some of the great things that the OHSU team has been able to accomplish in terms of automating prior authorization submissions. But I think it's important to understand kind of, at least for the reasons why I got into this around prior authorizations as well as us as an organization at Valer. And so, um, certainly as Phil described, I'm a pediatric urologist, a pediatric surgeon, and we started Valer over a decade ago out of my own personal frustrations with the impact that prior authorizations were having on my own patients. But I saw the day-to-day frustrations and challenges for my staff as well as the practice. And so it was one of those things that I felt like we had to do something about. So I've been at this, our team has been at this for quite some time, and we're glad to share some of the journey that we've been on with the OHSU team and with Joe. At Valer, our mission is quite simple. At the end of the day, every prior authorization, I tell our team, is someone's family member that we're trying to take care of, and so our North Star as a company is really to simplify and speed prior authorizations so that patients can get the care that they need and they deserve. And so I'll provide a little bit of more additional context in my perspective as a provider who's had to deal with prior authorizations. And I think everybody will be excited to see and hear from Joe about some of the work that he and the team at OHSU have been doing in conjunction with us. At the next slide. Next slide, please. Thank you. So from my perspective as a provider, it felt like every day prior authorizations were hurting my patients. Certainly as a pediatric provider with a heavy patient mix of Medicaid, this was a day-to-day occurrence. And just some information and stats about the impact that prior authorizations have on patients. And from a provider perspective, this is a survey from the American Medical Association that was conducted a few years back in 2023. 94% of physicians like myself reported that care was delayed related to prior authorizations. I know this is something that many of you probably live and breathe every day as you're struggling to go ahead and get authorizations completed so that patients can get taken care of. 80% of physicians surveyed reported that there was a treatment abandonment related to prior authorizations. Certainly this was a all too frequent issue with my practice that was incredibly frustrating, and one of the reasons that I got into doing what we're doing around helping organizations with prior authorizations. And the part that really was the most searing in my memory is that a third of physicians had patients who had a serious adverse outcome related to it. I certainly am not alone in having those experiences with really horrific and kind of bad outcomes related to a misstep, a crack in the system that happened related to prior auths that ended up to really hurt patients over the long haul. So there's a real reason that we do what we do at Valer in terms of trying to help organizations like OHSUs and others improve prior authorization workflows. But the next slide, please. So we've been doing this for over a decade as an organization at Valer. We have worked with many both clients as well as spoken to many organizations about some of the numerous challenges that when it comes to prior authorizations. And I know there are quite a few different challenges that organizations will run into, but there are a couple here that really stand out in a lot of the conversations that we've had with various organizations, and actually, I think kind of highlighted by some of the work that Joe and the team at OHSU have been able to accomplish with working in partnership with us. First and foremost, from our perspective, my perspective, is just really the intensity of how costly the manual workflows are that are associated with prior authorizations in both the submitting, the constant checking for status verification, the constant typing back and forth. This is just some information from a recent CAQH index report in 2023. The CAQH is a provider and payer industry stakeholder organization that tries to survey the cost around administrative transactions. And by that estimate, nearly almost 70% of authorizations still required some sort of manual intervention today, which is still astounding to me. An average time spent per authorization is about 22 minutes. I think we see a wide variety. I think we're all familiar with some of those more complex infusion authorizations that can take up to 45 minutes. And so it's an incredible amount of time that goes into the manual workflows, as well as a pretty significant cost. The average cost per authorization is roughly about $11 per transaction, and making it, I believe, the most expensive administrative activity that was laid out by the CAQH. Large part of the manual nature is really attributed to two kind of major factors that I think Joe will highlight and talk about. One is just the intensity of how manual the data transfer is between the electronic health record, whether you're on Epic or Cerner. It's just a lot of transcription of data back and forth with the insurance payer websites or fax forms. The other component of it is just how fragmented payer authorization workflows are, right? Every payer seems to have their own set of requirements in their portals, and you find yourself as a team kind of navigating into a dozen. My office had to go into 2 dozen, 3 dozen different payer websites to go ahead and submit for authorizations as well as to check and retrieve. Another major component around the issue that certainly was something that I appreciated in my own office was just the real sheer difficulty in seeing in terms of what the staff efficiency and productivity when it comes to authorizations were. A lot of this activity does still today occur outside of an electronic health record system, so it is difficult to capture and to quantify and look for ways to optimize and improve. And certainly the other aspect that was very intriguing in terms of getting more information and data around was around payer performance. And so, how long are payers taking to turn around information? What are their approvals? What are their denials, et cetera? There's a lot of regulation that is coming down the pike, as some of you may be familiar with, both at the federal level as well as individual states, related to more transparency, more accountability when it comes to payer prior authorization workflows. The last thing, we frequently hear about, and this was, certainly one of the key goals for improvement at OHSU with Joe's team, was around authorization-related delays that can happen. I think he'll touch a little bit on authorization days out as a concept to help reduce any sort of cancellations and rescheduling that have to occur related to prior authorizations. And for many organizations we talk to, some of the substantial issues with denials and write-offs associated on the back end with prior authorization. So I know this isn't a complete list of all the challenges, but certainly I think it does encapsulate a lot of the challenges that we're familiar with. I think Joe and team were familiar with, and many of you out in the audience are also familiar with. You have the next slide. So certainly a lot of this has really shaped our philosophy and kind of our approach on trying to help healthcare providers with prior authorization workflows. And I'll talk about some of the key kind of concepts that we focus on and what we specialize in. The first and the foremost is really, from our perspective, one of the big challenges that we see is around authorization submissions, right? Just how intensely manual they are, how much fragmentation and difficulty it is to get that work done. None of us are probably feeling the fact that there's less authorizations to be done, only just more complexity and more different workflows that have to be addressed. And so they come with considerable cost, complexity, the errors that are attributed to the manual work that has to be done that can lead to denials, and really a difficulty in having that visibility in what's happening. And so that's really what we tackle as an organization at Valer, building automations for organizations like OHSU and others out there. The second part is really we work to build around each client. I know all of us would like to think that all authorization workflows are standard and turnkey. We all know that they're not, and they're very complex and nuanced. And so we work very hard to tailor each client's Valer instance to their workflow needs. We work very hard to make sure that we integrate it into their system of record, which is an electronic health record system or a practice management system, to reduce some of the manual work. And our focus is really automating existing workflows. We're not asking organizations to completely adopt a brand new workflow. It's what their teams are currently doing, but being able to automate that workflow to expedite that. Incorporating business rules that make sense to help avoid mistakes, and really the reporting and analytics to allow for the visibility to continuously optimize. The last part is, in a world of complexity when it comes to prior authorizations with different rules, different portals, different payers, is to try to keep it as simple as possible for organizations. Our Valer platform provides one place or one platform to go out and navigate to all the different payer websites and manage all the fax forms. We pride ourselves in creating a comprehensive solution for all the payers, as well as all the different service lines that are required, not just a handful for imaging. We do surgery, infusion, et cetera. And then the other part of it is managing all the craziness that can happen with all the payer changes that are happening when it comes to payer websites. And so we manage all those in a kind of a rapid fashion so that our clients like Joe and team don't have to worry about that. And the last part is always really focusing on what does client success look like for organizations like OHSU, and that's what we want to steer all of our efforts in partnership to. And so with that, I'm excited to kind of turn it over to Joe to help share some of his experiences on this partnership journey that we've been on for the past several years.
Awesome. Thanks, Steve. Yeah, so like Phil said, I am Joe. I am Joe Whipple, the manager of Centralized Managed Care and Price Estimates here at OHSU. So just a little bit about our facility. We are one of two level one trauma centers in Oregon. We are also an academic teaching hospital. We have a children's hospital, and we have a whole bunch of outpatient clinics across Oregon and Southwest Washington. We currently have about 2,400 providers and just shy of 20,000 employees. Um, Next slide, please. So before I get into kind of how Valer was able to help us automate our authorization process and get us to where we are today, I'll just kind of recap a little bit about what Steve talked about a little bit, but more specifically what we were seeing as far as our challenges here at OHSU. So I'm sure we all can kind of relate to this first set of challenges, which is just the expensive, complex manual workflows of prior authorization. So, we were doing everything manually, from submitting our authorizations via a portal or a fax form. Everything was having to be filled out by our staff. Manually. There was no integration into our EHR. We were spending an unrealistic amount of time checking authorization statuses once those were submitted, and then submitting additional information, or whatever that workflow process was after the authorization was submitted. And of course, as we saw volumes increase across our health system, we needed to add additional FTE to be able to support the added authorizations that we're seeing coming through. So, we really set out to lean up our own system, our own workflows within our organization before we could look at automating to kind of get us to that next level of automation or process improvement that would take away a lot of these manual processes. Within that, we also obviously wanted to address our reduced revenue. We are a little bit different here at OHSU. We do all of our authorizations off of scheduled appointments. So that means the patient is scheduling these appointments, their services, their surgeries, their radiology testing and whatnot before we have authorization. Once those patients are scheduled, then they drop to a work queue and we're working those authorizations from there. So we really wanted to address authorization delays. So once that patient got on the schedule, we want to get those authorizations out the door as soon as possible to make sure that we're not having those rescheduled patients, those patients who would call in and cancel and then not have their imaging or their service done because now they're frustrated with the delay that authorization caused, because the delayed turnaround time on the insurance side, or we just weren't getting authorizations out the door fast enough for whatever reason. In addition to that, obviously, we want to reduce any claim denials that we were having. We were seeing denials, just human error, which of course happens in anything that humans kind of touch. So we wanted to look at what we could do to reduce the amount of errors that were being caused by that manual data entry, whether it was during the submission or once it was documenting that authorization when it came back. And then really addressing our patient dissatisfaction. We don't want our patients to be dissatisfied with their healthcare or turn to another facility or organization because of a prior authorization related issue. We wanted to make sure that, once that patient is scheduled for that service and their authorization is initiated, no part of the authorization process led to any sort of dissatisfaction for them, or any added stressor because they might have to reschedule that visit or that service. And then lastly, we really had a lack of kind of visibility to understand those errors and the delays in processing. We had very basic ways to measure our staff productivity, but it wasn't quite up to the standards that we wanted. And we also really didn't have a good way of managing payer performance. We didn't have a good way of measuring how many authorizations were being denied when they were sent out, how long turnaround was taking on average from a prior authorization perspective, how long it took our staff to submit those prior authorizations and whatnot. So that was also a big key piece of our automation journey, is we wanted to be able to have visibility into those key pieces so we could address them kind of on a basic level or a foundational level, and then build off of those from there. Next slide, please. So briefly, these are the results that we've seen since automating. So we've been live on Valer for a few years now. And I'll touch on these and then kind of show you how our journey went. So since we've been live on Valer, we've seen a 45% reduction in our processing time and the amount of touches that our staff have had to make on an authorization. And when I say touches, it's how many times are we, between submitting it, checking the status, documenting a denial or an authorization, or the fact that more information is needed, or phone calls to insurance companies to check on, whatever the situation is. A lot of what we were seeing was really just those off checks. Is this still pending? Is it done yet? Is it still pending? Is it done yet? Is it still pending? Is it done yet? Kind of day after day after day. So we've seen a 45% reduction on that. We've seen 11% more auths performed with our existing staff. This is a little bit of an old stat for us. We're actually in the process of updating this number. But the last time we pulled our numbers, like I said, we've seen an 11% increase in the amount of volume, specifically for our imaging department, that we've been performing, but we haven't had to add additional FTE due to the time savings that we've been able to see through our automation with Valer. And what that has done for us is our authorization days out has improved from 5 to 13 days. So like I said, we work off of scheduled services, scheduled visits. So instead of a patient being seen or scheduled and then us starting authorization about 5 days before their service, or us working authorizations today for services that are about 5 days from now, we've seen that increase to about a 13-day average. So things that our team are working on today are just about 2 weeks scheduled out 2 weeks from today's date. That ebbs and flows a little bit, just based on the staff being out and volume increases, but overall we've seen that average jump from about 5 to 13 days, which has directly impacted those authorization delays and whatnot I talked about a few slides ago. So this is our prior authorization approval cycle, really what we were wanting to see in a partner when we were automating our authorization process. So real quickly, a place that is going to submit our clinical documentation, something that's going to off-check for us, verify documents and information coming back from the payers, provide us that reporting on staff and on payer performance that we were looking for, so we could better understand what our overall picture looked like as far as what our staff is able to get accomplished, what they're getting done, and also what we're expecting from our payers, so we can level set with our internal clinicians and practices to understand when you schedule a patient what you can expect from us as far as authorization submission and then kind of a turnaround time from payers. And then what I personally would say, one of my favorite and most important things was syncing back to our EHR. Again, really reducing that manual workflows that we're having our team spend so much time of their day doing. Having that happen more automatically was really, really important to us. Next slide, please. Perfect. So we use Epic as our system of record. Of course, this is where all of our source data is kept, our patient demographics, their insurance information, all of our clinical records, everything, happening in a patient visit, their appointments, everything like that. Our authorization approvals, all is stored and retained within Epic itself. And then Valer, of course, is what we're using for our submission. So it's our one portal for all payers. from submission, status checks, verification of that information, and then reporting and analytics, like I said, to be able to kind of see our staff productivity and our payer performance, even as going down as far as the time it takes my staff to submit an authorization was important to us. So it was really important for us for these two platforms to be able to talk to each other. When we submit something or push something out of Epic, including clinical documentations, we wanted to be able to go over to Valer, or the system we were looking for at the time, and then be submitted in kind of a one-stop shop from there. Next slide, please, Phil. So this is kind of the first step. So what we wanted to do again was get that connection between Epic and Valer. Our team triggers what we call triggers our authorization to be submitted out of Epic. It flows into Valer. This is saving a lot of time in pre-populating because our staff isn't manually inputting all that patient demographic information from their name, their insurance ID, their phone numbers, addresses, all that information that we expect payers to want, as well as the clinical information, ICD-10 codes, diagnosis codes, CPTs, all that stuff is now all pushed directly from our system of record directly into Valer. This reduces obviously the delays in that manual entry process. It's not a human that's transposing a number or potentially entering a wrong CPT or wrong diagnosis code. So all that information gets transferred over from Epic directly into Valer. From there, Valer is able to submit to the vast majority of the payers that we work with here in Oregon. Just Medicaid plans alone, we have approximately 15 fee-for-service and managed care organization plans. So you can imagine just our Medicaid plans, how cumbersome it is to continually have to switch portals or switch fax forms when you're submitting authorizations. So the great part about Valer is it's one portal that we can submit to all of our insurance payers out of one spot. So it really reduces the time that our team is also having to bounce from portal to portal and sign in and two-factor authentications and all that good stuff. So this is what you can see here. That on the left side of the screen is all the information that is pushed directly out of Epic into Valer, including the rendering facility, our requesting provider information, and then, like I said, all those diagnosis CPT codes and all the patient information. And then kind of on the right side of that screen, you can see how it automatically populates into a fax form or into a portal if we're submitting into a portal, which we'll look at next. Please, Phil. So a lot of portals, or a number of portals, I should say, also have dynamic clinical questions. The great thing about Valer is we're still able to answer those clinical questions within Valer itself. Just like if I was on the portal, I can literally have Valer on one screen and the portal on the other, and I'm going to see the exact same process occurring between the portal and Valer. So any question that is going to be prompted to me within the portal itself will be prompted to me within Epic. We're also able to work with Valer to say, hey, every single time this question comes up, answer it this way. Hey, every single time this question comes up, prompt it to us because our answer may change. And that's what you can see here on this slide is, this is working through an imaging authorization, and that clinical question is prompted to us. What is the reason you're asking for this imaging? Our staff is then able to answer that question to the best of their ability based on chart notes and clinical information we have, and then click save and continue on. And then that next question that is prompted to us, we're able to continue working that directly within Valer, as we're also submitting 2 or 3 or 4 other authorizations to the same insurance payer or potentially a different insurance payer, and kind of keep our process moving. Next slide, please. So this view, again, is the Valer portal. What's great about this is it's a centralized spot for all of our authorization. So I can go in here and at a glance see all of the authorizations that my team has submitted, whether they're currently outstanding, if they've already been authorized, if they've already been denied, if they're in the process of being submitted at that particular time. It's a one-stop shop instead of, going again portal to portal. I can see exactly everything that we have submitted and where it is in the process. So it gives me obviously a lot more insight and visibility into what's going on as far as what we're able to get submitted, what we have outstanding that needs to be checked on. And it isn't portal specific. It's not payer specific. It's literally everything that we've been able to push through. The other great thing about Valer is they are continuously checking status for us. So we have Valer checking our pending authorizations 4 times a day. So what they do is at the designated times that we've asked Valer to check our statuses, they're going out and anything that's currently in a pending status, they're pinging that portal and checking to see what the status is. So for instance, we have a check, I believe, at like 5 a.m. and then again about noon. So if any authorizations have come back in that time frame, when it checks it at noon, it's going to bring back that authorization that we probably wouldn't have gotten otherwise until the next day. Prior to our automation, we were checking our authorizations once a day, usually in the morning. So this is continuously bringing us back status updates throughout the day. And so we can at any given time know what that status is. We can also go in and force Valer to check that status for us. So we are getting up-to-date information anytime we want it, again, in one spot without having to log into multiple portals. And then again, we can see our results once it comes back pending or denied. It's right here for us. We can go into each one of these and see the information directly as I would see it on the portal. So it's going to bring back a PDF of what that portal says, if it's pending or authorized, and all that information. Once that authorization comes back, that authorization information, the authorization number itself, the expiration dates, the number of visits we've gotten, all that stuff is populated into Valer. And then I'll discuss in a few minutes kind of what happens after that. But it all flows back into Valer, and then we go from there. Next slide, please. As I had mentioned a few minutes ago, reporting and kind of visibility was a huge part of what we wanted to see in automation. This here is, and currently an internal way for us to monitor our staff productivity. So this is an Excel spreadsheet that we use to track our staff productivity based on the metrics that we have set for them. So we have them working so many authorizations a day, and we use the data that we are able to pull out of Valer. So how many touches they have completed, how many authorizations essentially they have worked that day, to put in our spreadsheet, and we can see what their performance is based on the metric we've set. This is just a small snapshot of our diagnostics team and what their productivity kind of looked like for the last handful of weeks. So you can see, for the most part, everybody is well exceeding what our expectations are. Essentially, for us, anything 95 or above is meeting expectations, and anything above 100% is exceeding. So you can really see what we're able to do with this automation. And most of this reporting all comes back to us out of Valer. We're just doing some manual input of that specifically because we have this Excel spreadsheet that we built out for ourselves. So we take that information directly out of Valer, pop it in here, and I can see how my staff is performing. And then real quickly, we can also see like I said, our payer performance. We can see how long their turnaround times are taking. We can see if we're seeing kind of an uptick in authorization denials or delays. And then kind of one of my favorite reports is when we trigger an authorization into Valer, how long it's taking to actually get that authorization submitted, via the portal or whatever means that specific authorization is going, so I can see how long, the actual questions are taking the staff to answer, and the total runtime from the time they put it through Valer until we had a decision whether it's approved or a pending. Next slide, please. And then this, like I said, is my favorite, the bidirectional link between Epic and Valer. As I had mentioned a few minutes ago, we're pushing this information out of Epic into Valer to get the authorization submitted. So all that patient demographic, the CPT diagnosis, our clinical documentation, all that good stuff. Once that authorization is received, or even when Valer is checking those pendings those 4 times throughout the day, they're pushing information back into Epic. So we can go into Epic and look and see, Valer did an auth check, it's still pending. Valer did an auth check and it came back with an approved status. When that comes back with an approved status, it is actually pushing that authorization information back into our system of record. So it's putting in that authorization number for us. It's putting in those dates. It's putting in the screenshots in a PDF version of this is your approval. So, not only are we getting the data, we're also getting the same information that we would get if the staff was going out and checking it manually, which is really where I would say the big chunk of our time saving is coming, is between that auth check itself and then the time spent for our team to manually put all that data back into Epic itself. Those are really where we're seeing our time savings. And then, of course, we're seeing a lot less errors because we don't have that kind of human factor to be able to, mistype an authorization number, put in a wrong date. The great thing about Valer is we have it set up so if anything different between the authorization on the portal that was approved and what we have put into Valer itself, it flags us to review it. So we're not getting those errors where something was just a little bit off with the authorization. Anything that's a little bit off, Valer flags us and says, hey, you need to look at this. It doesn't match exactly. So we're really getting to that point where our authorization denials or errors are declining drastically because we're not having that manual input. And then, of course, everything is still maintained within our system of record, right? So everything as far as our authorization pieces, just like it was when we had a very manual process, still is within Epic, is still accessible to anybody throughout our organization, whether they're within our department or within the clinic itself, or our HIM team. Anybody still has the exact same visibility as we had when we were doing it manually as they do now with the automation. So that was also really important with us and extremely important to our HIM team to make sure that visibility was stayed the same. Documents came back into Epic and went and got filed to the correct places, and there obviously wasn't any PHI information. So that was extremely important that we address before go live. And again, like I said, is very important just for visibility. All right. Last but not least, I think just a few quick things. These are the benefits that we've seen with our automation. We have seen that our staff productivity has improved drastically, as you could see by that little chart, where most of our staff are hitting over 100% of the metric we've set for them, as well as we've seen an 11% or more increase in just the amount of authorizations that were able to get submitted with maintaining the same staffing levels and not having to add additional FTE to kind of keep up with that work. We've seen that increased revenue because we're not having those errors from the manual authorization information being inputted by our team into Epic. We've seen a great improvement in our patient satisfaction because we have that 5 to 13 day lead time that has increased. So we're not having last minute cancellations or reschedules because patients' authorizations are still pending. And then, of course, this allows for continuous improvement. The Valer team has been great. We've been working with them for years now, and we still continue to improve the automation and what we want to see, and the asks that as new things arrive, hey, we would like you to do this. Hey, we need this now. Hey, can we do this? So we can continue to improve the automation between us and the payers, and also be able to just get those authorizations out the door a little bit faster, more timely, and then kind of address all of these things as we continue to do so.
Wonderful job, Joe. Thanks so much. Sorry, I was a little delayed coming back on camera. We've got just literally a few minutes left in our webinar, and we do have some great questions that have come in. We'll have a time to maybe answer a couple of those in the remaining time that we've still got. Joe, maybe I'll ask you this, or maybe actually, Steve, I'll ask you this question from Emma. Are there any types of authorizations that Valer is unable to complete? For instance, surgical, procedural, imaging, and so on.
We cover the full gamut. I would say the one area that we have kind of purposely avoided as an organization is the medications that go through the pharmacy or formulary benefit, the typical standard formulary benefit, whether it's Cover My Meds or Express Scripts. We do cover complex infusions and special medications, but we pride ourselves in being a comprehensive solution across all the different service lines, whether it's PTOT, cardiac imaging, radiation oncology, you name it. Notice of admissions, I think there's a question before. So we do cover the full gamut range.
Thanks, Steve. One other question from Alan, I'll also pose to you, Steve, is he's curious whether Valer has had similar success with clients using Cerner instead of Epic.
We have, Cerner has, we do have Cerner clients who are able to have the same level of success with the bidirectional integration. There's a little bit more variability on the Cerner side that I'm sure many of you all are familiar that live in Cerner, but we do have clients that we're doing the bidirectional data exchange with similar type results.
Steve, one other question. I think this really related to your upfront piece. This is a great question. This is from Brittany, who asked, how did you come up with the average cost per authorization metric at the beginning?
Yeah, I think it was a survey of the time motion that goes into the CAQH index report. Certainly, we can circulate the link. They will go into the cost estimates of how they do that, but certainly they'll have some methodology in that report. So.
This may have already been addressed sort of in your presentation, Joe, but an attendee asks, just to clarify, is OHSU using Epic or only using Valer, and Valer pulls it from the Epic system?
Yeah, that's a great question. So we start essentially the authorization process in Epic. We make sure that it has the diagnosis codes, the CPT codes, all that good stuff that we want Valer to transmit to the payer for us. And then we have a trigger within the referral itself that we switch the authorization to pending. We put in that trigger, and then when we accept out of Epic, it goes over via 278 message, which I am not an IT person, so I cannot tell you the fundamentals of how that works. But it goes over via magic wires and goes into Valer, and then out of Valer is where we actually start the authorization submission process, and then kind of the reverse of that when the authorization comes back. Like I said, when Valer gets that authorization back in it, then they automatically push that information back into Epic automatically. So the process kind of starts and stops in Epic, but the authorization, submission, status checking, all that good stuff happens within Valer.
Thanks, Joe. So we are at time, but I'm happy to spend a few more minutes answering a few more questions. Joe and Steve, presumably you have a few minutes. For anyone else who wants to hang on and hear a few more questions answered, certainly feel free. Joe, one question from Lizette is what version of Epic are you on? Do you know?
I believe we are about 6 months behind. We're about to do an Epic upgrade, I think, in a week or so. So it should be the spring 2024 version that we will be upgrading to.
From Mary, maybe Steve, I'll pose this to you. Does Valer send to all payers for the same patient at once?
It's certainly Valor has the ability to, with a function called Submission Automation Manager, to queue up multiple concurrent authorizations to go out to different portals, so it can be done. Now, whether or not it's all simultaneous, there's a little bit of lag in between as users kind of prep and submit. But we do have the ability, and Joe can talk about it. It's actually one of the functions we actually developed with the OHSU team to really kind of help multitask. Joe, do you want to talk a little bit about SAM?
Yeah, absolutely. So Sam was a brainchild, I would say, of a few different members of our team who really like that multitasking ability that they had when they were doing the manual authorization submission. So it was important for them to be able to kind of continue that. So we worked with Valer to I guess address that particular I wouldn't say concern, but ask that our team had. So we with the help of the great team at Valer, came up with what we call SAM, which is our Submission Automation Manager. And the way I like to explain it is kind of think of like tabs you have open in Chrome. So within Valer itself, we can prep and start submitting multiple authorizations. And as we're doing that, tabs open up at the bottom. So I can, start 4 or 5 authorizations at a time, and then I can toggle between those tabs and answer those dynamic questions if they need to be answered, or do whatever that particular authorization needs, which it needs at that particular moment, which allows us to get those authorizations out. And those can be to the same payer all at one time. So, I can be submitting 4 authorizations to the same payer, or I can be submitting those 4 authorizations to 4 distinct payers at a time. Just kind of depends on what that employee is doing at the time, but it allows them to be able to have that flexibility to kind of prep and get multiple things going all at the same time.
Thanks, Joe. This next question is from Anna, who asks, how long did it take your organization, Joe, to transition to Valer?
So Stephen, Phil, and I were just talking about this a little bit ago. Our story is a little unique. We started this process right before COVID. And then COVID hit, and our organization was like, and that's not a priority for you anymore. So we got delayed, I would say, about 6 or 7 months. So I would say, all in all, about a year and a half. If you probably take that 6 or 7 months out, it would probably be just shy of a year. That we really went from when we identified Valer as like, this is the direction we want to go through, and went through all of our contracting and legal and getting our stakeholders involved, and doing observations by the Valer team, and then the builds on our Epic side and the build on the Valer side and stuff like that until we had our go live date. If we take out the little COVID delay, I would probably say it was just shy of a year.
Yeah, and that's for the whole process, Joe.
Yeah.
Evaluation and everything, right?
Yeah.
Great. How about denial management, Joe? Can you talk to a little bit about that? I know you mentioned a couple times some of the avoidable errors that don't occur now because it's automated, but I don't know if you can shed any more insight on your denial performance.
Yeah. So we don't have an extremely robust pre-service kind of denial reporting system in place. We can see trends, like I was saying, through what we're submitting through Valer, but we don't have a super robust system as far as looking at pre-service denials. Our claim denial process is more robust. We do have a monthly meeting where we review all of the claim denials that we've received that are attributed to authorizations, and we do deep dive into those. Mostly what we see with those are either incorrectly identified as not needing an authorization, or a change of service. We got an authorization, and then the provider got into the service that they were doing and then decided that actually needed to do something else. We have very little, if any, authorization claim denials due to authorization errors. So it is something that we keep an eye on. We just don't see a lot of it anymore because of our automation. We don't have everything within our department up on Valer. We are definitely doing things in increments. So those areas that we do still have a manual process or a manual workflow on is where we see those authorization error denials. But definitely from what we're putting through Valer, we rarely see that anymore, comparatively to what it was a few years ago.
Great. That's helpful. That's actually a good segue maybe for this next question to Steve. Allison asks or says, many similar products are only able to connect to certain payers and can only obtain prior auth for certain services. How has Valer been able to establish connections with all payers?
Yeah, so that is one of the real differentiators from our perspective about what we do with Valer is to cover all the payers that your teams have to work through. That was a frustration for my own team, where they didn't want a automation solution or a vendor that only handled one or two of the payers only for things like diagnostic imaging. So we do cover. We work very closely with our client teams to build out all the different payer websites and fax forms that they are working through, and then we build those automations in conjunction with those teams to cover all the different payer websites, the fax forms, and then really across all the different service lines. So we do, once again, have a wide range of service lines. So you're not limited just to a specific set of payers or a really a service line like diagnostic imaging. I know a lot of organizations are limited, other vendors are limited to that. We cover the full gamut. We understand that people have to do all the different areas for authorizations, and we want to provide one place to do that.
Thanks,
And
Steve.
if you don't mind, if I can piggyback off that just real
Please.
quick, that was a big thing for us as well when we kind of started on this journey, and talking to a lot of vendors and finding out that hey, they can only support 25 or 30% of our payers, and that was something that before we went down this road of automation, we needed more of a kind of a return on our investment. Great that you're able to help us with 20 or 30% of our payers, but we need more than that, right? To be able to really show that this is working for us, and to really get to that point that we wanted to be of automation and trying to get as close to touchless authorizations as we could. And that was the one great thing about Valer, is it does allow us to be able to connect to all of our different payer platforms. We have a pretty good payer mix here. So it was important to us to be able to capture as many of our payers as possible. And that, the 20 or 30% that some platforms were able to do just wasn't a high enough kind of percentage for us to be able to buy into that, because we needed to see that we were able to connect to more payers than 20 or 30%. So that was a huge thing about Valer for us, and kind of one of the draws is that they were able to connect to our payers, our forms, our crazy payer mix that we have, especially here in Oregon.
Thanks, Joe. Steve, this next question is for you. What is the timeline that your customers typically see in terms of ROI?
Yeah, it does vary from organization to organization, as you can probably imagine. Like, obviously, our goal as an organization is to try to get to as immediate ROI as possible. Once again, it's a process where we're working in conjunction with partners, like as Joe mentioned. It varies. Some of the organizations that, the beauty of kind of the automations that we do build is that people will start to see the results in the ROI as soon as they go live and they start adding new payer websites or fax forms, so that once the go live happens, the ROI return starts building. It depends on how the organization wants to approach the rollout and ramp, whether it wants to start with specific service areas and or specific payers. And so there's a little bit of variability. I think we always, as an organization, try to point out where the maximum ROI will be and where to start. And that's part of the partnership discussion that we have with organizations. So, it's a little bit of a roundabout way to say it depends on kind of the implementation thought process and how an organization wants to tackle it. But our goal as a company is always to get to immediate ROI as quickly as possible once the automations are built and live for an organization.
Thanks, Steve. Many of you have hung on for another 10 minutes, which we appreciate. We'll try to wrap up here in the next couple of minutes with maybe just one or two more questions. Joe or Steve, does Valer take care of radiology exams from outside doctors? I don't know if you've got that in your case, Joe or Steve, if you want to comment on that.
Yeah, I can absolutely comment on that. So I will say yes. We do have one of the hospitals in our health system that we do support outside imaging requests from, and we are able to submit those through Valer. That's not the practice of like the largest, our main hospital. We actually don't support those authorizations. We expect those referring providers to get those authorizations. So yes and no, only because we just don't, that's just not a practice that we have at our organization. But for the smaller community hospital that we have as part of our health system, we do support outside ordering providers, and we are able to submit those authorizations through Valer. There's a couple of portals we had some hiccups with, but it was mostly our staff access to it and having to update their access on that specific portal to be able to submit those authorizations. And once we did that on our side, then Valer was able to submit those authorizations for us seamlessly.
Thanks, Joe. We'll make this the last question since we are coming up the top of the hour. And Joe, I again maybe poses to you, is the suggested workflow for staff to work through a work queue or by going to each individual prior authorization looking for a status update from Valer?
Yeah, so I think that is dependent on your practices as an organization. So we have our teams all working out of work queues. So they're patient work queues because they capture those scheduled appointments. So when they're new or they haven't been submitted yet, they're in what we call a new work queue. And then once they're submitted, they drop into our pending work queue within within Epic. So when our team is checking those authorization statuses, just to go into the referral in Epic and just see what updates Valer has made. When they're checking statuses first thing in the morning, Valer has usually checked it an hour and a half before they're getting to it anyway. So they'll do a quick review of the note that Valer has put into Epic, and just to make sure that there's no additional action. So if the note just says that this is still pending authorization, then the team closes that referral and moves us on to the next thing, because it was just checked an hour and a half ago. If that note says like, hey, additional information is requested, or it's approved with that, like I said, that little flag that Valer's like, hey, these two things don't match perfectly, then they go in and they do those reviews. So most of our working through pendings, or what we call pendings, so authorization status checks and whatnot, is done out of Epic, and then reviewing the message that Valer has sent over. And then if there's anything that we need to do as far as additional information or whatnot, then we'll go into Valer and kind of see what that response has been brought back from the payer, and then address it as we go from there. If that makes sense. I hope that makes sense.
Thank you so much. That was great. And Steve, again, thanks for a really informative hour in the end, and a lot of great questions from our audience, which we really appreciate. We appreciate everyone's time and interest in OHSU's case study today, and a little bit about Valer. And again, please remember to fill out the 5-question survey at the end. Otherwise, have a great rest of the day. Thanks again, Joe and Steve.
Thank you
everyone for attending.